Health Education Lecture Series. All the listeners of Health Education Lecture Series, I am your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah N. Court, Dublin, California 94568, and phone number 408 687 1899. Email address homeomedicine, HOMEOMEDICINE @yahoo.com. Anytime if you are suffering from any disease and tired of treatments, you need second opinion about your disease as well as of the treatments, yes, you can call me at 408 687 1899. I will give you my expert opinion based on my 52 years of medical practice, out of which I was teaching in medical colleges in India for 26 years, from 74 onward. And since 96, I'm here in USA. Since then, I'm delivering my lectures on health every day on different radios, TVs, and newspapers. People are listening me all around the globe, and I'm getting your messages from around the globe, from various countries, and I give them my opinion based on my knowledge. Most of them, they are interested in taking homeopathic treatments from me, and yes, I'm mailing them medicines from USA, California, to various other countries if they are suffering from any kind of disease and they are under my treatment. But my process is basically, we do not consider that this body is the preliminary attack. This body is the secondary attack. The first of all, the vital force which is responsible for all the functioning of this body, that is sick, that falls sick, that comes under influence of any other outwardly influence. Just like I give many time examples about the mosquitoes or any other type of infectious agents or influences, they attack our physical body. What we see that they are attacking our body. Our body is of no use until the vital force is there. If a mosquito cut a dead body, do you think he will have a fever? He will have a malaria? No. Even if the mouses are all around the dead body, they will produce any plague to that body? No. Yes. Another processes of the dead body, fermentation, and all other conditions of the dead bodies may occur over there, but not the disease as we diagnose it. What does it indicate? It indicates that body itself is not responsible to produce any disease unless there is a vital force, unless there is a living force who controls all the functioning, sickness and in health, all the functioning of this body. And that is the influence, that is invisible power, as I have explained many a times in these lectures, that powers cannot be seen. Powers could be realized when they are acting upon any other physical body, because our physical eyes are only capable of seeing the physical things, not beyond that. Though we have developed the sciences, like microscope, ultra microscope, many other various things that we can see deep, more minute things. And but still, it is up to a physical existence. Wherever this physical existence finishes, after that there is a power. And even now, we have realized that the powers are still being subdivided: electrons, neutrons, protons. They are all forms of the powers. It, and these are all the steps of knowing this power, subdivisions. It means powers are still likely to be subdivided. And it means it means that a similar kind of thing, and which is beyond our senses. Senses means our ear can hear a sound, our eyes can see up to a level, distance level, or up to a minute things. There is a limit. And all the sensual organs, they are having their limits. But I'm talking about that vital force which exists inside this body, and this body works, all the organs working in a normal orders. But if that power is affected by any other influence, under those conditions, this body represents the wish of that our vital force, maybe in you can say forcibly or in cooperation. And forcibly means we talk about the disease. In cooperation means when you run and your heart is pumping more. When you run and your respiration, number of respiration goes more. This is in cooperation. But when any influence is causing our vital force to suppress its function and follow the direction of that influence, just like of the mosquitoes, I had just explained about that one. If the mosquitoes have bite a physical body, that physical body's response is sent back, telecast to that power through the nerves, through the brain, through the mind stuff. And ultimately, it is extended to that vital force, that power, which is responsible for all the functioning of this body in health and in disease. So, in this way, those powers becomes sick. Those powers express that something is overpowering us cooperatively, just like I told you in the exercises. Blood pressure may rise, blood pressure may go down, blood palpitation may go rise, and the respiration rate may go up. All these things are cooperative type of functions. But non-cooperative is, we see 98.4-degree temperature is a normal temperature. And if it goes, suppose if you exercise, if the palpitation is increasing, if respiration is increasing, it means the temperature should be increased. No, temperature is likely to be decreased, because evaporating the toxic substances are evaporated through the sweating, even the breathing. Temperature comes down. So these are all the cooperative effects of our exercise, of our functioning of the body in a normal way. But when this body is attacked by some other influences which are capable of molding the function of our vital force according to their wish, and our vital force is forced, bound to work according to his wish, then it produces something like different symptoms, just like palpitation when you exercise, number of respiration increased when you exercise. It's a cooperative. But when without exercise, when without any kind of exertions, if this thing is increasing, respiration number is increasing, temperature is increasing, blood pressure is increasing, it indicates that our vital force is under impression or under force of any other influence, like similar. I'm using this word because we know, as a physical existence, as a physical entity of the universe, we are entity of the universe, that we cannot mix air into salt into the air. That salt is salt, physical body. Air is not visible like that. But this cannot be. One form of the substance cannot be mixed directly into in the same way into form of the other shape, just like the ice, water, and steam. Ice cannot be directly mixed until this ice is converted into steam. Same way, salt cannot be mixed into gas, any gas, until it is converted into the shape of gas. Same way, the physical or material things which are harming or capable of producing disease, we say, in the body, their influence, unless their influence is in the shape of vital force, it cannot influence our vital force, except the outwardly accidental type of things. It cannot affect. It will affect only when it is in the same shape. It will hurt physical body. It will forcibly change the external type of things. But ultimately, the disease process, which is the prerogative of our vital force, that will not be produced. Yes, after after injury to the leg, if vital force is there, if injury to the dead body, it will not produce any type of inflammation, any type of degeneration, any type of repair or anything else. Nothing will happen. It will remain as is. But if the vital force is there, ultimately, even this injury was outwardly, but after that, a function of the vital force starts to repair that wound, and also, if it is the vital force is not capable of repairing that wound, then there is a inflammation, and then there is a degeneration, then there is a necrosis, and all these things happen in systematical way. So, to convey this message, I want to tell you that because of the vital force, we are surviving. And that vital force is a type of power. And the powers we cannot see. We can just realize those powers when these powers are acting on any physical body. Just like many times I give the examples of tube lights or any machinery or even the computer, you can see this. So all these things are working if the power is there, because of that power. So in this way, uh, we are discussing the physical, but we will go to that lecture. We will go to later on to that subject, that how this vital force works, how we can realize this vital force is working in order, how we can realize that this vital force is sick or is not working in order. That's a disease. Definition of health, definition of disease, definition of cure. All these things we will describe later on. What's the meaning of health? In short, just like I can just say now, uh, harmonious play of vital force. When everything go easy, all the function which are performed by the vital force, and we can see only the physical body. And if the physical body is working normally, there is no complaint, no pain, nothing else, and every function is going on normal. That is the harmonious play of our vital force, because the vital force is responsible for the functioning of this body, normal or abnormal. So this is the definition of a vital force working normally, or you can say the health. So health is the harmonious play of vital force when all the functions of all the organs are added to construction this body are working in a normal order. Sickness, when this body represents itself with some abnormal functioning of the organs, of different organs. There are different organs, different systems inside the body, just like the 9 systems are working inside this body. And if and we now, as a medical man, we know that what is the functioning of eye, what's the functioning of nose, tongue, ear, everything, liver, heart, lungs, everything we know. What's their normal functioning? We have now up to the mark that we know about this one, that this is the normal functioning. But when these functioning are going abnormal, though it is represented by the vital force, if vital force is not there, we cannot see this type of changes. But vital force is there, still the functions are not normal. Body functions are not normal. It indicates that our vital force is influence of any other influence which is not friendly. And that influence is forcing our vital force to work according to his wish. Many times I have examples about that one. If one emperor has been taken over by the other one, then all the administrative things, just like the courts, just like the police stations, just like the post office, whatever you can mention, whatever the administration is going on will change and will work according to the new emperor. Everything will remain the same, but the law will change. They will follow the different type of law, and the justice and the functioning will change everywhere. The same way happens in this body, that whenever our vital force is under influence of any other influence which is not friendly, then they are fighting. Just like you can say the easy word is the fighting. They are fighting with each other, and ultimately that wherever that the outwardly unfriendly influence is overpowering, that causes change of functioning of this body. Just like the temperature will change, indicates that our vital force is fighting with the outwardly influence, but still is lacking that power to eradicate that. That's why there is a fever. Ultimately, when that outwardly power will go off, beaten up, overpowered, then this fever will go. Everything will come to normal status. In this way, outwardly influences are affecting and are forcing our vital force to work according to his wish. And in the body, somewhere we see the changes in the system or in the organs. Oh, liver is damaged, liver having a jaundice or anything else. Any heart or any lungs or any pancreas or whatever the organs we can name, they are not functioning normally. It means this body is under influence of some other influences, outward unfriendly influences, that is a disease producing powers, and they are forcing our vital force to work, to start functioning in this body according to his wish. That is why the functioning is changed. And if we collect from head to heel the all disturbances in the normal functioning, that will make a sketch of the disease, that will make a sketch how the outward influence is affecting our vital force in whatever way, and we have to strong that part. If enemies are coming to attacking our border, attacking our country from one border, then what we will do? We will strong that border. We will send the force over there and will try to block that area. In this way, we are trying to protect our body organs, our this body or functioning everything from the outwardly influences, disease producing agents, so that this body should continue working normally, but now it is forced to work according to the wish of the outwardly influence. And those influences are invisible, not the physical things. Physical limit is up to the body, and physical limit or the sensitivity of the body connected by the nerves to the brain express this thing. And there is exchange office, you can say, just to let you understand easily, there is exchange office of thoughts, and these physical conditions are converted into thoughts, and then an answer comes up, just like if you are touching any hot wire, any hot things, and immediately in a fraction of a second this message goes to the higher center of the vital force, and that vital force immediately sends the center order back, okay, take it out. How long it will take? In fraction of a second, order goes, order comes back. Not like our governments like that one. If we send an applications, even that will go many years into the court, or many years in the processes to work on. So in this way, so this vital process is stronger. So sometimes we say medicines are not working, or whatever, it's not working. It means the impressions created by the medicine is not going up to the higher level of vital force, and vital force is not able to respond to that. What to do? But what generally is happening in different kind of medicines, when the medicines are not suitable and the medicines are not in a direction to remove the influence of this thing, then what happens? After a short while that medicine expires. That's why the doctor says, okay, take this capsule or tablets after every 8 hours, because they know, they have experimented it and know it, that after 8 hours or after 6 hours, this medicine which we are giving to suppress the symptoms of the disease at the time will be eradicated, will be washed out from the system. Means that influence which was producing the disease is still there. We are not doing anything for this one, but we are just combating the symptoms, just like the allopathic styles. We relieve the pain by hook or a crook, but we do not know about that one, what is causing this pain, unless we deal with that cause which is producing the pain abdomen. And you are giving painkiller medications, they will give you some relief, no doubt, but temporarily. But ultimately, the doctor will say, okay, you have to repeat this medicine after this hours. It means they know it, that we are not treating the actually cause. We are just benumbing, making numb the local area of nerves, so that it cannot send any information of pain to the central higher portion. In this way, I have given many time examples that sometimes you give some painkillers, just like we are taking the easy example of the pain abdomen, and we are giving some medications for that one. And when we are giving some medications for that one, and after the effect of the medicine, as we know, it's for 4 hours or 5 hours, effect is over, And after that, we do not feel pain. It means the credit goes to that medication. So, oh, this medicine I took, and after that, there is no pain. It is relieved. Credit goes to that medicine, but basically, that medicine has does not do have not done anything with the cause of the pain. The cause of the pain was just you can understand it is indigestion, and whatever you have eaten that has not been digested. And if that has not been digested normally, it is causing pain. And you are giving this painkiller that has no relation with the digestion process. Digestion process is gradually going on. Ultimately, under the time period of effect of that medications, digestion is over. After that, there is no pain. And you will give credit to that medication. But suppose underlying cause of pain is a cancer, underlying cause of pain is a tumor, which will not be relieved, which will not go off, cured, removed within that short period of 4 or 5 hours. Then what? Then you have to repeat the medications. But how long? Ultimately, you will continue to taking those painkillers, and ultimately, after taking these painkillers for a longer period, it will again become a problem for you, create a problem for you, and it will be difficult for you to bear both stress, one for the disease and one for this medication. It automatically will become a disease, drug disease for you to take care of this one. In this way, what's going on in this medical science at this time? This is what we are giving painkiller medications, we are giving the suppressive medicines in all the systems and all for all the organs temporarily, but we are not going deep to the reasons behind that pain, that disturbances in that organ or functioning in this system. And that goes on, and repeatedly you have to repeat the medications unless the underlying causes are removed. Means whatever is influencing that vital force to continue that process of producing the disease is not removed, this thing will continue. So this is what I want to convey before today's lectures, that we should go with the way of treatment to cure the persons which is desired by our vital force. Desired means what type of help that vital force is lacking, and we should provide that. That is why any other influence is influencing our vital force, and the vital force is bound to produce tumor, bound to produce different name of the disease, just like I told you about the cancer or anything else, bound to work according to his wish of the outwardly influence. Then you have to make your vital force stronger enough so that it can combat that outwardly influence and can run its normal course. And ultimately, the effects produced by that outwardly impression gradually will go off. The tumor will dissolve. Anything blockage will be removed. Will take time, but it will be removed. Now, as far as the cure is concerned, as far as the cure is concerned, it is only possible if we understand the language of the vital force, what the vital force wants us to do, what type of help the vital force wants to give. That is that is the language of the disease. That is the history of the disease. Since from head to heel, everything has changed. One thing I would like to explain again, that this body is working like a single unit does not mean that the liver is if liver is damaged, it is not having any effect on the other organs, not at all. If heart is affected, does not mean that the other body systems are not having any effect of all. Any organ, even small pimples are on our tip of the finger, you will be having a feverish, whole body tired feelings. Why? Every cell of the body is connected to each other and they are having a close relation with them. Just like if any nearest and dearest has died in our family, and we will feel that pain as our relation is nearest to him, and relations with the distance will feel little less pain of his death. In this way, some of the organs are showing more influence of the disease, more damages in their area. Some are not producing that much type of abnormalities. Blue Star happened in Punjab, and I have learned from the South peoples, they do not know it. They just had a news. They just read the newses in the newspapers, or something was going in the west side. This is what they know about. But country was a combined. Whatever the force of the country was used over there, it was it was forcing. It was changing the economy of the country. And as the economy of the country is concerned, definitely all the states are equal. All the state will have to feel that one. In this way, I want to express you that every disease, though it has influence in any special system of the body or any special organ of the body, does not mean that the disease is only in that organ or in that system. No, all the body parts are suffering from that one more or less. And that is why many times I have given the examples that if you remove a cancer from any body parts, does not mean that cancer producing criteria has gone off. No. Many times you will see the peoples are dying with the same disease, same problems, even if the organ has been removed, which were suffering from that disease. The cancer organ was removed, but even then you have seen that many times ultimately peoples die from the same thing. Many of the things are still not in the knowledge of the medical science, but the philosophy has recovered that one. Just like when any skin problem is suppressed from outside, the effects of that goes to the lungs. And if after using a topical ointment on the skin and you have removed that skin problems outwardly, and ultimately that patient next time after 2 months, 3 months, or 4 months comes that any lungs problem, even simple or grave, you doctor will not say that this is the same thing, this is because of that one, that skin disease was suppressed, and that suppressed skin disease is affecting the lungs. They do not. No, they do not believe it. But the truth is that yes, external suppression goes inward unless the real cause of that production is treated and removed. What are the causes of the eczema here? Until that is removed and you suppress it by any ointments, ultimately will go to the internal organ where it's related. Pain knee joints, pain other joints. If you treat forcibly without knowing the causes inside the body, causes which are changing and producing the knee pain, until you treat those one, until you cure that one, until you remove those things, ultimately person will come after a few months with you, doctor. I have a problem. I have a pain in the chest. I have, oh, doctor, check is you have high blood pressure or you have something wrong inside. The ECG is saying something wrong in the functioning of the heart and whatever. But they will not say it that it is all because that you have suppressed previously with the treatment that knee joint pain. But the medical philosophy has recovered nowadays. we have researched that go deep, that every cell of the body is related to each other, and every cell of the body, if producing any sickness type of symptoms, and those symptoms, if not eradicated by removing the actually cause of its production, it will go to the other organs. It will go to the other organs, and ultimately person will suffer from some other organs problems, and the doctor will not correlate this problem with the that problems. Just like nowadays, a trend is going on that whenever there is a any gallbladder problem, they remove it. Oh, it's no problem. Bile is produced every time continuously, and if it's not stored in the gallbladder, it will go directly to the intestines and will go out of this body with these stools and this and that. No, it's not. Purpose. There is a purpose of gallbladder. And with that purpose, when you remove that gallbladder, ultimately this goes directly to the intestines. It creates, it is absorbed. I want to say this everything we eat through by the food goes to the intestines, and in the intestines, all the required materials, vitamins, minerals, fat, whatever is required by the body is squeezed from the intestines, from this food in the intestines, and is mixed back into the blood. That's the process. And the cisterna chali and all that one, it goes to be mixed up into the fresh blood making process. And how you can say that if the bile is directly coming to the intestine, if a bile storage room you have spoiled, you have cut it, and that bile is continuously going to the intestines and being absorbed. When you are eating, that bile is mixed up with the food, and some portion of it is absorbed. That's a normal thing. The other will go with the stool out. Whereas when you are not eating, the bile is produced continuously. Listen, understand this thing. Bile is a continued process, 24-hour, produced in the liver, and now it is that was stored in the gallbladder here, but now with the common bile duct, it's directly going to the intestine. And when there is no food, actually the maximum portion of this bile is assimilated from the intestine, which will go directly to the blood. Very easy thing to understand. There's no any confusion about this one. That will be absorbed from the intestines and will go back into the cisterna chyli, and cisterna chyli will continuously fill up and will be mixed into the new blood formations. It will go to the blood. Already circulating blood, it will be mixed into that. And everything, wherever it is required, it is absorbed. And when there is an excess of a bile, which is continuously coming, and it will be having a more ratio, big ratio inside mixed into the blood, what will happen? It will make its concentration excess than normal into the blood. And ultimately, though all the other organs of excretion, they will try to because it's unwanted things. All the organs, just like the kidney, just like the skin, they will try to remove this one as a garbage from that one, from the blood as well. But even then, after a long time, this concentration will become more. This concentration more will be stored inside the cells. And when this is stored inside the cell, ultimately you can well imagine, then extra things are stored in your store, then you will not be having sufficient space to store the required things there. You need to store the required things in your storage rooms. But something extra has come up. Suppose your neighbor has come up and give me, okay, yeah, I'm going out, or I'm changing my home, and this table and chairs and all that, you please keep it in your storage. And he goes off. And ultimately, your storage, you need to store your own things in a regular way. You will not be able to. You need oxygen, you need proteins, you need fats, whatever the required things are, calcium, minerals, vitamins, which are coming every day, which are used every day, every time, and which are coming every day, every time by the foods, by the stores. But there is already a fixed accommodation which is not being relieved, which is not being evacuated, and ultimately a long time at a distance. It produces many other things. It clots somewhere. I have seen patients when gallbladder was removed, and ultimately the person suffers from the cancerous type of tumors, growth, different on the different body parts. There are type of tumors, molds, many things appears inside the body, and any tumor, any wart, anywhere inside the body, if it's okay, normal. But if any time this wart, this tumor, this papilloma, whatever is the normal things going on without pain, it starts paining. You feel pain of it, oozing, bleeding. Any of this kind of sign appears in the normal tumors, normal things which were going long back with your systems are dangerous, and ultimately they become cancer. They become cancerous. So, in this way, I just want to convey by this lecture to all of you, when you remove the desired organ from the body, their function is carried out by other organs, which are those organs are having their own function. Then it will cause some hindrance, it will cause some problems over accommodations, and ultimately that over accommodation will go from one cell to the other to the other. Ultimately there are trillions of cells inside the body, or anywhere it can deposit. Means the excretion which should go in a normal way. And suppose if the gallbladder is continuously storing the bile, and when you eat, everything, gallbladder continuously constricting, relaxing, contracting, relaxing, and when you eat, everything is put out, goes to the intestines, that's mixed with the food, and ultimately portion of it is assimilated, otherwise it will go waste with the stools. That is why you see, if there is a problem in the bile, stools are white, stools are yellow. Oh, we can say there is some problem in the liver if the stools are black or terry-colored stool. So in this way, I just want to convince you, to convey you this message, that whenever you do any surgery or remove any organs, does not mean that you have cured the person. You have altered the way of normal processes of the body serums. These are body serums. Bile is a body serum, and it has a normal process to go out of the body. But you have changed the track, and ultimately, one train was coming in time, and the was taking passengers normally. But now this train is continuously coming. And all the time there is no passenger, will go waste. The same thing happens with the piles. Same thing happens when you do surgery, like just appendix. If we have not taken care of why the appendix is inflamed, why the appendix is inflamed, because there are some problems in our eating, because there are some problems in other organs, because the appendix is a lymphocytic organ, lymphatic organ. And the lymphatic organ, the purpose of all the lymphatic organ is to clean the WBCs. Means the WBCs are disturbed, changed because of the toxins produced in any organ, and those cells are circulating, going back into the bloodstream from that cells, and ultimately by the lymphatic organs, lymphatic nodes or lymphatic channels, they are separated from the normal blood, and they are stored in some nodes and some type of organs which can clean them. WBCs, they are cleaned by lymphatic organs, and similarly this appendix is a lymphatic organ. So if you remove that lymphatic organs, if you do not take care of, and there is inflammation in the organs, what happen? It means you have removed a friend, you have boycotted a friend. Okay, I don't need you, but he was helpful to you, because you do not understand that. That is why the doctor cut it out. Okay, let it go, and this friend will be injurious to you. Why this friend becomes the enemy? You have to take care of that one. You have to correct those things. Why my friend is becoming my enemy? But what you are doing, you are disconnecting that friend. And but the purpose he was solving for you will not be solved. So ultimately, all the things circulate inside the blood, all the things are distributed, their toxins, into the different organs, and those toxins are stored in the body everywhere in the cells, and, and some points they produce some different kind of disease. And that is known as malignancy. Basically, one tumor from one side, it goes to the other places from the lymph nodes. That is known as the metastasis, just like it happens in the cancer stages. Cancer was in the uterus, cancer was in the prostate, cancer was in any other breast cancer. Cancer was in any organs, and you are removing that one. Toxins are circulating from that cancerous stage back to the bloodstream, and nature is separating that one from the normal circulating blood, so that all the organs should be saved. But if this toxin is increased enough, and this channel which is filtering this toxin from the normal bloodstream is full, no, not accepting any other toxins, ultimately the toxin will go to the bloodstream, and it will go to the different organs, and it will produce the similar type of criteria in the other organs. And that's why we say, oh, cancer has spread all over. So all these things happen. I'm just giving you these examples that why nowadays there are big number of diseases. First of all, there was only seasonal diseases. If you go 100 years back, there were not that much diseases. Ultimately, some of the diseases came up, and then because of our ignorance, we have changed them. You have changed the route of those disease, and the different other names come up in the system, and we are after that one. And in this way, the surgery interference, yes, sometimes it may be saving life, but does not mean that the cause you have removed. Just like I told you about the gallbladder. Just I told you about the appendix. Does not mean that you have treated the cause and it will not happen to any other organs. It will. It will happen at a long distance. But the folly is this, that you will not believe that one. You will not justify that it is all because you remove the gallbladder, you remove the appendix. No, you will not. And this process is going on nowadays. This process is going on nowadays everywhere, and surgery is the important thing everywhere, which is going on for all the organs without knowing the cause. Yes, sometimes some of the diseases are that kind that they do not give us time to recover. Old age. Under those conditions, we say, okay, whatever time we have to live, we should live peacefully, painlessly. And then, yes, go for a surgery, it's okay. Because if you go for the recovery, it will not give you time. The age will not give you time, that much time to recover that one. And you can suffer for a longer period. Under those conditions, yes, surgery may be helpful for that one because you have not that much time. There are some criteria for the surgeries where you can give green signal to the surgery, but not always. And after that, I can tell you many other things about this one. We have talked about the disease, we have talked about the cure, and how you recover. All these things we have discussed about these things. Okay, so the recovery of every patient does not mean that you have removed the organ and you are done. No, I have explained you in detail. When you remove any organ by surgical means without knowing what are what was the function of this thing, and if this function has been removed, how it will affect the other system of the bodies. I give you the detail of gallbladder removing and the bile functions and also the appendicitis. In the same way, it's not only these two things. There are many more any other things. Just like I can talk about the hemorrhoids. Many of the peoples, they are in habit of removing the hemorrhoid bars. They remove it. Oh, it was heavy bleeding, this and that. But they do not know the actually anatomy, structural formation over there, and the physiological functioning of that part. If you understand that, then you will understand this thing, that removing the warts from the anus is not over, that you have treated the hemorrhoids. It will create many other problems in your system, but you will not correlate other problems that you have removed the warts. That's why you are suffering from this thing. I can just explain you in easy way. Blood goes from heart to every cell of the body, to every system of the body. Blood from every system of the body, from every cell of the body, goes back. When it goes in, it is supply the oxygen and food to every cell. When it goes out of the cell, it takes garbage of that cell back to the stream to be evacuated from the body. And this is the normal routine inside our body. But there is a change in this system. There is a change in this routine, that the intestinal blood does not go directly back to the heart. From my finger, blood goes back. Blood comes here by the artery, blood goes back to the heart. From head, blood comes into brain, goes back. From each and every organ, this is the routine, and everybody knows about this one. But there is a change of routine in the rectum, you can say. You can understand because the bawasir, hemorrhoid is concerned with the rectum, so I can say rectum, but not only the rectum, it is the intestinal portions. So what I want to convey you that blood comes to supply the food and oxygen to the intestine with the same routine as all the organs of the body are supplied. But Vapsi, go back of this blood is not in the same routine as with the other organs. Blood from the intestinal area, you can just understand from the rectum. It's easy for you to understand. Blood from sigmoid colon, from rectum, from anus, these are three big portions from where this piles is initiated. Hemorrhoid is initiated, bawasir. So, blood from this portion of the intestine do not go directly back to the heart. It goes to the liver via a separate system nature has set up that is known as portal system. So by portal system, this blood goes back to the liver, not directly to the heart. And when it goes to the liver, and if there is excess of this accumulation of this blood, and there is a big congestion in this portal system, ultimately it will be having a backward pressure. And backward pressure will cause engorgement, bulging out of blood vessels inside the rectum. And here is the name of this artery is a hemorrhoidal artery. That's known as hemorrhoidal artery. And when hemorrhoidal artery enter into the rectum, it is divided into three portions, three branches, just like a big canal is changed into three branches. Same way, the hemorrhoidal vein, artery, hemorrhoidal artery is bringing blood from the heart to supply this rectum area, just to say rectum area. And when it comes to this rectum area, this hemorrhoidal artery is divided into three branches. And their situation is like just like 3, 8, 11. You see the watch where there is a signal of 3 o'clock, 7 o'clock, 11 o'clock. In this way, these branches are in this way, and these branches are supplying the blood to the rectum, food material, and all other things. But when it goes back, it is not going by the hemorrhoidal vein. No, it is going by the other system that is known as, that is, sorry, I think it disconnected with this car. It is disconnected and it goes to the liver, and engorgement of this one when it's full of this one, because in the liver it takes long time to dissolve and then go by the azygous vein to the heart. It takes a long time, and accumulation is in the abdominal area in the portal system, and pressure is downward. That is why the downward veins are bulged out, and those bulged out, if you put more gas in a bubble, ultimately that becomes tight, and that causes painful. And if you strain passing the stool, they are lacerated and blood comes out of that. And now, if you remove the or stitch or whatever, do cauterize the warts, it's not going to recover the process. It's not going to cure this thing. Ultimately, where this blood will go back, how it will go back, it will find out another organs, another way out. And every time you will feel distended abdomen, heaviness in the abdomen, the intestines, full abdomen. Even you eat, if you are eating 4 5 chapatis, now you are taking only one chapatis, and even you, oh, I'm full here, I cannot eat more, because your intestines are full of that blood which was supposed to go back, and you have cut the connection. So this is what's going on in the system. So we should understand all these things. Understand all these things, the physiology, how the nature has set up this body, so that if we work according to that, surgery will be success, or the treatment will be success. But if just to remove the symptoms, we do that one, it will give us another problem. It will create another problem, and we will not correlate that next problem with that surgery. So if the distension of the abdomen, yeah, indigestion, or all these things, you do not correlate all these things with the hemorrhoidal surgery. You do not, but it is. So I this time is over today. I'm your host Gurdeep Singh Sandhu, homeopathy consultant. My clinic address is 9701 Sarah and Court, Dublin, California, 94568. And phone number 408 687 1899. Anytime, if you are suffering from any disease at any time, at any age, you can say, you can call me to take a second opinion about your disease, and I can guide you properly for that. Okay. So if ever you want to take a treatment, homeopathic treatment, you can call me 408 687 1899. I will give you my expert opinion about that one, and will treat you systematically how the nature has set up this body, how the functioning of these bodies are going on according to that. God bless you all. We'll see you tomorrow for the other lectures of our routine system health education lecture series. Thank you.